Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about shingles, also known as herpes zoster, a painful condition caused by the reactivation of the varicella zoster virus, the same virus that causes chickenpox, of all things. Once you've had chickenpox, the virus never completely leaves your body. Instead, it can hide quietly in your nerve cells for decades, only to reappear later in life as commonly called shingles. To help us understand what causes it, how it's treated, and what's new in prevention and management, I'm joined by my friend and colleague, Dr. Bryn Henderson, a board certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being with us today.
Well, thank you for having me. It's a privilege.
So let's get to it. What is shingles?
Well, as you mentioned, shingles is the reactivation of the varicella zoster virus after someone has had chickenpox, usually. The virus stays dormant in the nerve ganglia, which is sort of the root. Later in life, due to factors like aging or weakened immunity, it can reactivate, travel along the nerve, and cause a painful, blistering rash that follows the path of that nerve or dermatome.
All right, let's talk genetics. Can someone be born to inherit shingles?
Well, yes, shingles isn't directly inherited, but the studies show that people with a close family member who had shingles have a higher risk. Certain genetic factors, like variations in immune regulating genes, may influence how well your body can keep the virus at bay and in check.
All right, what about early development? What happens there?
The nerves where the virus hide are formed during the womb, development from the neural crest. These nerve pathways determine where the shingle symptoms will appear. For example, if the virus reactivates in the trigeminal nerve, it can affect the eye or the face.
Okay, so what symptoms should people watch for?
Usually it starts with pain, tingling, or burning in one area of the body, often the chest, back, or face. Within a few days, a rash appears with fluid-filled blisters that eventually crust. The pain can be intense and in some cases may continue for months after the rash heals and is gone, a complication called post-herpetic neuralgia.
How do you diagnose shingles?
In most cases, shingles can be diagnosed by observation, and its distribution give us an answer. In rare or atypical cases, you may need a PCR or other types of testing that can confirm the presence of the varicella zoster virus.
All right, let's talk standard of care treatments.
That's sort of easy because you use an antiviral and some medication like acyclovir or valacyclovir. Both work best when started within 72 hours. Pain control is also important. And that can be done with anti-inflammatory medications, neuropathic pain medications like gabapentin, and sometimes even topical treatments like lidocaine patches.
Well, let's talk traditional Chinese medicine approach to shingles.
In traditional Chinese medicine, TCM, the shingles is seen as an imbalance involving heat and dampness. In certain meridians, particularly the gallbladder and the triple burner, the treatments include acupuncture, pain relief, herbal remedies to clear heat, and toxins, the cupping or bloodletting to improve circulation.
And let's go to your area of expertise, regenerative medicine.
We're exploring therapies like regenerative cells that may help repair nerves, and there are injections you can get to repair damage to the post-herpetic nerve. Exosomes therapy is also studied for its ability to reduce inflammation and pain, as well as promote nerve healing. Certain peptides, like thymosin alpha 1, may help regulate immune function and potentially lower the risk of recurrence.
Dr. Henderson, I've heard that platelet-rich plasma, or PRP, might be used in cases of shingles, especially the long-term nerve damage like post-herpetic neuralgia. I have had so many older women, it seems more than men, that have this post-herpetic neuralgia, and they're suffering.
Well, PRP, without a doubt, has four functions. It contains growth factors, it contains healing factors, it increases blood supply, and decreases pain. So that involves using your own platelets and injecting them into the targeted tissues. In this particular case, it's helping the nerves. These platelets release growth factors and bioactive proteins that can promote nerve regeneration, reduce the inflammation, and support tissue healing. In the context of shingles, especially when the nerve injury leads to chronic pain, PRP helps restore nerve function and decrease that discomfort.
All right, so you talked about injecting the PRP to target tissues. Do you do it right into the rash? Do you do it around the edge of the rash? What are you talking about target tissue?
The source of the illness is in the root of the nerve. So you target the root of the nerve. Usually it's adjacent to the spinal cord, wherever the nerve is affected. You go to as far back into the cause of the root as you can and inject it. It doesn't do a lot of good to inject it peripherally. You have to get it to the cause of the infection. And the other thing you can do with this is you got to watch your temperature.
So, what can patients do at home to help themselves?
Good question. You keep that rash clean, dry, wear loose clothing, avoid scratching, stay cool. Hot showers will kick that up like it's a red flag. It hurts so much. Managing stress, getting enough rest, and following a healthy diet also support immune function. Importantly, a vaccination with a recombinant zoster vaccine can significantly reduce the risk of shingles and its complications.
Let's talk about this vaccine. When it first came out, there was this rule that if you had had an episode or an outbreak of shingles before you were 60 years old, you were not a candidate for this shingles shot, shall we call it. Now they've changed the rules.
The primary candidates for a shingles vaccine are adults age 50 and older and adults 19 years and older who are immunocompromised due to disease or therapy. Individuals with weakened immune systems due to conditions like blood cancers, HIV, AIDS, or those who have undergone stem cell or organ transplants are also recommended to get vaccinated.
Why did they go from one shot to two doses?
The reason they had an increase in that is because studies revealed that they had better responses when they staggered them.
All right. So what's the outlook for people with shingles?
Most people recover fully within a few weeks. Some have experienced longer and have lasting nerve pain. Early treatment helps shorten the illness and the complications. Prevention through a vaccine is a game changer, especially for adults over 50 and those with weakened immune systems.
What's your mnemonic for shingles care?
It's easy. It's pain-free.
P stands for?
Prompt antiviral treatment.
A.
Avoid scratching to prevent infection.
I.
Immune system support through diet and rest.
N.
Nerve pain management.
F.
Follow up if pain persists beyond rash healing.
R.
Rash, hygiene, and protection.
E.
Eye checks for facial shingles.
E.
Early vaccination for prevention.
Well, thank you, Dr. Henderson, for sharing your expertise on shingles and the importance of early treatment and prevention. If you or someone you know has shingles, seek care right away. And if you're eligible, talk to your doctor about the shingles vaccine. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.